Hello everyone, Dr. Matt Ed. Today we'll talk about the fourth universal definition of myocardial infarction. We'll talk about the spectrum of myocardial injury. We'll talk about the difference between myocardial injury versus myocardial infarction. We'll talk about the difference between type 1 versus type 2 MI. So why the reason for the new definition? It's because of these high sensitivity cardiac troponin assays. And now that most hospitals are adapting to these, it is important to know. And because of these high sensitivity cardiac troponins, any stress or insult to the heart will cause elevation of these troponins. And as a result, it's been discovered that myocardial injury can exist without acute ischemic heart disease. Myocardial injury, or injury to the myocytes, can be acute or chronic. It is acute when there's a rise and fall pattern of high sensitivity cardiac troponin with a greater than 20% change. And chronic will be continued elevation of troponins and the variability is less than 20%. And if there is any ambiguity of myocardial injury due to acute ischemia, one can diagnose the patient with acute myocardial injury first until further testing to confirm ischemia. This is a representation of the spectrum of myocardial injury, ranging from no myocardial injury to increased troponins indicating myocardial injury to clinical evidence of acute ischemic myocardial injury, meaning myocardial infarction. And you can see that around the circle, there are different entities that can involve or precipitate these myocardial injury or myocardial infarction. Here we have a table for clarifying the difference between myocardial injury and myocardial infarction. The table starts if the patient has elevated cardiac troponins above the upper limit of normal, and if there's a troponin rise and or fall of greater than 20%, then we go on this side. And if there's a troponin level that's stable or less than 20% change, then we go down the right side. Here we have to decide if there is acute ischemia or no acute ischemia. With acute ischemia, we think about vessel stenosis, coronary artery vessel stenosis. And without acute ischemia, we believe that there is no involvement with injury to the coronary arteries. If there is acute ischemia, then it progresses to acute myocardial infarction. And there are two types, type 1 MI versus type 2 MI. So type 1 MI is by atherosclerosis plus thrombosis, and that is due to plaque rupture or plaque erosion, and this pretty much occludes the whole coronary artery. And type 2 MI, the pathophysiology is from oxygen supply and demand imbalance, and that can happen with a stable coronary artery or coronary artery stenosis, but there is no complete occlusion of the coronary artery, and this can be caused by other clinical presentations such as hypertensive emergency or sepsis or severe anemia, etc., which includes all the entities that was shown in the previous slide. Here, hypoxemia, hypotension, kidney disease, heart failure, ventricular tachycardia, anemia. If there is no acute ischemia, but acute myocardial injury, meaning no involvement of the coronary arteries, but there is direct insult to the myocardial sites, this can be caused by acute heart failure or myocarditis. And to differentiate the difference between these two is basically based on the clinical presentation and the clinical history. Here on the right side, if the troponin level is stable and there's a change in less than 20% with repeat levels, then we can be pretty confident to say that it is a chronic myocardial injury. And that can be due to the structural heart disease, or if the patient has chronic kidney disease, or if they're on dialysis. Most of the time we see the patient's troponins are elevated, but it's stable and doesn't rise or fall that much. A type 1 MI occurs when there is plaque rupture, erosion, and thrombosis that occludes the whole artery. and usually they present with STEMI. Here you can see that on the picture here, the plaque rupture and erosion with the occlusive thrombosis pretty much occludes the whole artery. A type 2 MI is when there is evidence of acute myocardial ischemia but do not have acute coronary atherothrombotic injury. And this is the pathophysiology is that there is oxygen supply and demand imbalance, and this can occur in a fixed coronary obstruction, coronary vasospasm, coronary artery dissection, as shown in the image on the right. And most of the time this presents as NSTEMI with elevated troponins, but no ST elevations on the EKG. Also want to take a moment to mention the diagnosis of acute MI. So diagnosis of acute MI requires a rise and or fall of troponin of at least 20% with at least one of the following: symptoms of ischemia, there are EKG changes indicating new ischemia, development of new pathological Q waves in the EKG, or imaging evidence of new loss of viable myocardium or new regional wall motion abnormality. And the information and the images are from these references. And if you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you.